Thank you very much for that lovely introduction. So, my name is Dr. Rana. So, as mentioned earlier, I'm a geriatrician. Okay, so I'm a geriatrician for the older adult, and I have a special interest in continence because unfortunately the reality is as each of us grow older, our body goes through certain changes that actually makes things different for us compared to, let's say, when we were younger. So when we are younger, we feel like we want to pass urine. Okay, I can hold off for a longer period. But as you age, unfortunately, there are changes that happens as part of nature, where how much urine you can hold compared to when you were younger, it's lesser. And how long you can delay from the time, okay, I feel I want to pass urine. How long can I delay that urge to go to the toilet? Also, the duration reduces. So these are things that we do expect as we grow older, but the purpose of this talk is not to say, okay, this is it. We're getting on in our years and we have to accept this. That is not it. And that's the main message that I hope to carry out today. So nocturia, a thief of sleep. So how many of us here actually have woken up more than once to pass urine in the night? I have as well. Yeah. So sometimes it can actually be quite severe where we may feel that we're spending more time in the washroom than actually in our bedroom. Okay. And then sometimes it just feels like you're waking up over and over again and there's actually no end to it. And sometimes we wonder, okay, this is happening as I'm getting older. Is this part of aging? Do I have to accept it? Is this it? Okay. So what is exactly, before we go into all this, what exactly is this word nocturia? So nocturia basically means the urge and the need thereafter to wake up to pass urine in the night more than once in the night. Okay? And what we need to understand that nocturia is actually a symptom. That means something that you present with, but it's not a disease condition itself. And it can signify that there may be something else that's going on in your body beyond aging, okay, that warrants, that means that that would be good to see a doctor and get worked up on. Okay? And it's actually more common than we think. So about 50% of all adults above 65 years of age do tend to wake up at least once to pee in the night. And about 24% of these older adults can have 2 or more episodes of waking up to pass urine in the night. So it's actually more common, but more common does not mean that we have to accept it and let it be at that. And so what? So what if this happens? The implications is obviously that it disturbs your sleep, okay? And then once you wake up, falling back asleep is an issue as well. So insomnia, okay? This can affect your mood, your productiveness the following day as well, okay? It not only affects you, but it can also affect your partner or your caregiver as well. Okay, and in our older adults, the studies have shown very clearly that waking up to pass urine more than once in the night also increases your risk of falling down and fractures or breaking bones. Okay, so it is a very serious problem. But the good thing is, it is potentially treatable. So the main thing we hope to send out the message is don't suffer in silence. And through multiple things such as modifying the lifestyle, behavior modification, or medications, depending on what is causing this nocturia, we can potentially achieve results and treat this. Okay, and then we hope that we can all be more productive, think more clearly, lower our medical risks, and reduce our risks of falling. So, why does this happen? Okay, so broadly speaking, nocturia or waking up to pee more than once in the night can be due to A, your bladder. Okay, the bladder is the organ that holds your urine. Okay, it can't hold urine as much as it used to before. Okay, if this is something that has recently happened, you also need to wonder whether could this be a urine infection that's going on. Okay, where in the day, in the night, you're feeling the urge to pee and it's fairly recent. Okay, if you have other features like there's some pain when you're passing urine, fever, okay, in some there can be blood in urine as well. it needs to be seen by a doctor urgently. Okay? Or there can be other conditions. Some people have the urge to pass urine day and night very frequently, okay? And it might be because the bladder is more irritable, okay? And so you feel that urge. It's what we call overactive bladder. Or in men, as you grow older, the prostate, it's basically a small structure that surrounds the urine tube just below the bladder. Okay, it enlarges. That is something that happens as you grow older in men. But in some, it can cause some issues, what we call when the prostate is very big, it can cause issues with urination and the urge to pass urine as well. Okay, or it can be due to the kidneys, okay, making too much urine. In some, it can be day and night. Then we look at certain causes. In some, in a small population, it can also be particularly passing a lot of urine in the night specifically. Then that is a condition of its own that we call nocturnal polyuria, okay, where you pass more urine in the night. And then for this condition, after working up, there is medication that is approved with good results, okay, that can be potentially used. Of course, everything has its risks, so that's why you need, if you have this condition, you need to seek attention, and then we can work up from there. Or sleep disruption. So this can be due to sometimes because of poor sleep hygiene or sleep habits as well, okay, that we will talk about in subsequently, okay, or it can be because of a sleep disorder of its own as well. So if you look here, it's actually a busy slide, and that's exactly my intention. To say that nocturia is just a symptom. We need to work out potentially what are the things that, whether there's any medical conditions that are actually contributing to it, and then treat it accordingly. So broadly speaking, what I'm trying to say is here, it can even be something as a sleep disorder of its own, okay? Or it can be, for example, some people, if your partner says that you're snoring very loudly in the night, or sometimes stopping breathing in the night as well, then that is a medical condition of its own called obstructive sleep apnea, and that needs medical attention as well. Okay, it can be some people, as we grow older, we tend to develop problems with our heart or kidneys in sometimes. Okay, and what happens sometimes is that there can be water retention that happens, and our legs can get swollen as well. Okay, and then when we go to bed at night, all that water returns upwards, and then you wake up to pass urine. So things that can cause such conditions are the heart issues, kidney issues, or in some, as part of growing older, blood vessels are a bit more leaky, so they don't work so well, so the blood tends to collect in the legs. Okay, you may notice sometimes at the end of the day, your legs are more swollen compared to when you woke up in the morning. So these are things we need to assess as well. Okay, or it can even be because of some hormonal issues as well. Okay, sometimes some people with thyroid issues, they can also have urine nocturia, where you wake up to pass urine. Or if you have diabetes, I mean, Singapore now is at war against diabetes because that's how high the prevalence of diabetes is. And if your diabetes is not well controlled, it can also cause you to pass urine very frequently. Okay, so or for example, sometimes some people, they may have certain what we call nerve conditions, neurological conditions, okay, such as increased stiffness, shaking, okay, sometimes things like Parkinson's is something perhaps you all may have heard. These are also things that can cause urine problems, and we need to manage the medical condition. So which is why, as you can see, there's multiple issues here that needs not only a doctor actually, but also needs the nurse, the pharmacist, physiotherapist. So it's a team effort, okay, to actually managing such a condition. So the take-home message from this very busy slide is that there are many things that can cause you to wake up to pass urine. So don't suffer in silence and seek help early. Okay. We also look at medications when a patient comes into our clinic complaining of nocturia, because some medications actually can predispose you, can worsen these urine issues. Common things is people on, let's say, certain medications called furosemide or water pills for your heart condition. Okay, depending on the timing that it's taken, it can also worsen. Some blood pressure medications as well. Okay. Sometimes common cough, flu medications that we use, it can also worsen urine, urge to pass urine frequently. So medications can affect, and we need to have a look at them as well. So beyond this medical thing, it's not only about medical issues and treating with medications, but equally important is also lifestyle changes, and these are things that you can do as well from now. So basically, common top tips I would say is, what can you do? Number one is avoid things that irritate your bladder. So if you look at this chart, okay, so there are certain fluids, drinks that you take that can actually irritate the bladder and then make you feel like you want to pass urine frequently, including at night. Okay, common things are the coffee, okay, or different teas. Okay, so what would be a better option is to have more water, okay, and decaffeinated drinks. Common thing that I hear in my clinic is like, I have some patients, doctor, I pass urine so many times, 6-7 times in the night. Then when you ask, okay, do you take coffee? They say, yes, I take kopi 3 times a day. I actually have few at least telling me this. Okay, so obviously we already know one of the major contributors for the nocturia in this patient. And if you look at it actually, some of us, we like to drink the fancy lattes and all that. But if you look at the coffee content, your latte, 1 shot of espresso only has about 55 milligrams of caffeine. But you take your kopitiam, the kopi O, right? A cup of it actually has 260 milligrams of caffeine. Okay, so the kopi O 3 times a day clearly is something that contributes a lot. Okay, the other thing is the timing of taking this as well. So it's okay, you don't have to stop taking your favorite morning coffee. Okay, but ultimately it's about balancing, what you feel is acceptable to you in terms of waking up to pee in the night, and compare it with the things that give you pleasure in life, like coffee. I like my morning cup of coffee, it's okay. What I would generally say is try to avoid coffee about 6 hours before you sleep. Okay, and some people don't realize that a lot of the tea, including the herbal teas, they also have caffeine as well. Okay, so something to keep note as well. Alcohol is something else as well that can irritate the bladder. So preferably 6 hours before bed, do avoid it. Okay, then the distribution of the fluids, likely my colleagues previously would have covered it as well. So sometimes we tend to self-restrict our fluid, and we have seen this where, like, okay, I don't want to wake up to pass urine, so I will limit the amount of water that I drink, the fluid I drink. But that's actually not a good thing, and that can work against you. Because if you don't drink enough water, that is going to irritate your bladder as well and make you feel like you want to pass urine frequently. And there is no magic number. I have patients, I believe in drinking a lot of water because that's good for the body. But there's no magic number that I must drink 2 liters, 3 liters or so on. Go by the color of your urine. If your urine is pale yellow in color or colorless, then that's a good indication that you're actually drinking enough water for yourself, rather than a number per se. But I would also suggest that you redistribute how much you take throughout the day. Take more from morning to afternoon, and take a bit lesser from afternoon to roughly about 7 p.m. And generally try to avoid fluids 4 hours before bedtime if possible. Okay, but if you have medications, you can take with small sips of water. Sometimes some people tend to keep a jug of water at the bedside, keep drinking in between, the bathroom trips in the night. So that's something else to avoid as well. Okay, so I mean, if you feel thirsty, yes, you can have some. Some people use ice chips as well, but I mean, it depends. It might make you go to the kitchen to get the ice chips instead. So ultimately what I would say is you can wet your mouth, but try to minimize the amount of water you drink. And in some of our patients whose memory is not so good, and I'm not sure if there's any caregivers of such patients here, we say try to avoid keeping visual reminder like a jug near the bedside, because that will trigger them as well to keep drinking in the night. Okay, so minimize fluids 4 hours before bedtime is the other thing I would say. Okay, then number 3 is also covered, reduce the fluids in between sleep. Okay, and number 4 is this, Okay, so some of us, we may notice that there is swelling in the legs. Most important thing is to make sure that there is no medical condition such as a heart issue or kidney issue or something else that's causing it. But sometimes as we grow older, because our blood vessels are more leaky or muscles are weaker, so the blood tends to pool. So and this can actually increase your nocturia, because when you go back to bed, all that water returns upwards and you wake up to pee. Okay, so things you can do is afternoon naps. If you can do it, it's a very good idea and it helps. Okay, so generally, because what happens is when you do an afternoon nap, you're basically gently getting the fluid, the water to go back up. But try to cap your nap to 90 minutes or less, and try not to take a nap after 3 p.m. because that can make your sleep at night an issue. Okay, another thing is elevating your legs up. Okay, ideally we say put your legs up higher than heart level. Okay, that's obviously quite high. If you can't achieve that, at least something is better than nothing. Okay, then finally compression stockings. Okay, so this one I would say it's important to get medical advice before you get a compression stocking. Okay, because there are certain medical conditions that we wouldn't advise for compression stockings. Okay, some people, the blood flow in the legs may not be so good, so in such people we wouldn't advise. Okay, and the other important thing is that just any stocking doesn't really help. Okay, because it has to have a certain amount of 20 to 30 mmHg, a certain level of compression pressure basically to help. Okay, ideally we want a full-on stocking. Okay, but studies have shown that even a knee-high, those who feel that I really cannot, this hot weather, to put one till here also can help reduce the number of times you wake up to pass urine. And finally, sleep hygiene. Okay, I can't stress this enough. Okay, I have patients, yesterday I just saw someone who told me, okay, I wake up to pass urine 3 times. I'm like, okay, what time do you go to bed? Oh, I go to bed at 8 o'clock because I have nothing else to do. Then I was a bit surprised. Okay, okay, because that's one thing that I need to really stress. Bed is a place you go to sleep. Okay, so if you're not sleepy, don't go to bed and just lie there trying to fall asleep. Okay, instead, and only stay in bed if you're sleeping. Don't go to bed unless you're very sleepy. Okay, and avoid screen time before bedtime. Okay, ideally at least 1 hour before bedtime, avoid screen time because it disrupts your sleep, the light from that. And this is something that's proven. Okay, and then it's always a good idea to try to go to the bathroom before you go to bed preemptively. Okay, physical exercise is actually quite good and it helps with your urine issues, but try the timing wise, try to avoid doing it later in the evening because that can disrupt your sleep as well. Okay, and ultimately I think in the previous talks we would have covered about pelvic floor exercises as well to strengthen the muscles as well, and also try urge suppression techniques. That means sometimes just because you feel the urge to pass urine doesn't necessarily mean that you should go and pass urine if it's happening very frequently. You may try to employ some suppression techniques as well. Because the thing is, when you get used to passing urine at the first sense that, okay, I need to pass urine, then this is also going to carry forward in the night as well, where even the bit of the urge, you wake up because your body is just used to that. Okay, I feel the urge, I wake up, pee. So there is a role for that as well. So strengthening pelvic floor exercises, urge suppression is also important. And finally, if you do wake up to pass urine in the night, okay, try to keep disruptions to a minimum. Okay, keep the lights off. But having said that, safety is important. So if you do feel that you want to go to the washroom, keep a lighted, low-level lighting so that it lights your path to the washroom. Ideally, we tell some of our patients, if you can keep a bedside commode or urinal, then that will disrupt your sleep lesser. Okay, so that at least you can fall back asleep faster. Okay, so that in a nutshell is what I wanted to convey today. Happy to take any questions from any of you. Thanks.
Sorry, we are doing the questions at the end.
Oh, okay.